Good evening. The Prime Minister is preparing to spend a second night in hospital where he's being treated for persistent symptoms of coronavirus. Mr Johnson says he's receiving excellent care from the NHS at St Thomas's Hospital and says he's keeping in touch with his government colleagues. He first tested positive for the disease 10 days ago and had been self-isolating in Downing Street until last night. The latest official figures say that 439 people in the UK have died in hospital from the effects of coronavirus in a 24-hour period. And that brings the total number of deaths in hospital from the disease to 5,373. And these figures do not account for people who have died in the community or in a care home. Now, in a moment, we'll bring you a full update on the Prime Minister's condition and the functioning of government while he's unwell. But first this evening, we have a rare insight into conditions at one of the biggest intensive care facilities in the UK. There's University College Hospital in central London. This special report is by our medical correspondent Fergus Walsh and cameraman Adam Walker.
It is completely unimaginable, and we're not at the peak yet.
This is the front line in a war.
Apart from 2 patients, every patient we're looking after has got COVID. We can't cope with a big spike. We just can't.
Every day, some battles are won
Is one of the doctors here?
and some are lost.
He's been on 75 and actually when the HME was changed.
All the patients here are critically ill.
We're planning for many more patients, so all our theatres to be full of COVID patients and possibly beyond. It is, you know, none of us have ever seen anything like this.
This used to be a recovery area for patients after surgery. Now it's an intensive care unit for COVID-19 patients. A huge part of the hospital has been transformed in order to deal with coronavirus.
I've been in intensive care nursing for about 23 years now, and I've never seen anything like this. Even the London bombings, I've never seen it in such a short, condensed period of time.
Many of the patients here are elderly or have underlying health problems, but not all.
I think perhaps I was a bit naive when we started. I'd assumed that it would be the older and the sicker. In here we've got a mixture from people in their 40s to people in their 70s. A lot of them have got high blood pressure and diabetes or a bit of respiratory disease. But some of them are coming through who are young and fit.
The patients here have severe pneumonia, inflammation of the lungs. They must be heavily sedated while on a ventilator, a machine which takes over their breathing. Patients can spend 2 weeks like this. Many drugs are being tested, but there is, as yet, no proven treatment for coronavirus.
So it's oxygen and organ support and amazing nursing care, really.
One thing that does help is turning the patients onto their front. It increases the oxygen getting into their lungs. What seems like a simple procedure takes time and lots of pairs of hands.
Okay, everyone all right? Yep. Ready, steady, 90.
With ventilated patients, extreme care is needed.
Okay, ready?
All of this while staff wear full personal protective equipment.
Well done, that's great. Okay, can we just check that he's ventilated?
Their only barrier against coronavirus. Every time a doctor or a nurse goes onto the unit, they must don full safety gear.
You can't wear this and work for more than a couple of hours because you've got a crashing headache, you've got a dry mouth, you have to get out.
Staff write their names on their aprons so they can be quickly identified.
So there's an emergency on the ITU. The head of critical care was seeing via walkie-talkie whether he could give a second opinion.
Yeah, do you want to stop and done and come in?
But he needs to be there, so the full kit has to be put on.
They use walkie-talkies because their visors mean they can't communicate on phones. It is draining, physically and mentally.
It's really hard, and some of our staff really can't cope with it. You know, we've got a huge number of nurses, doctors and physios, and not all of them can deal with it, so they can only spend a short time or not just any time. It's not uncommon for some of our staff to have had panic attacks, and just finding this so stressful. So we've got to really support people. Some people just can't do it.
Despite the possible risk to themselves, the medical staff carry on. 12-hour shifts, 60 hours a week are the norm. They worry about the patients, about each other, and about those they love.
I think it's very hard on our families. My kids are at home, my wife's homeschooling. It's easy in a way for me. I'm doing my job, I'm busy all day. They don't really know what it's like here, whether we're bringing home the virus, and they've just been amazing. Just let me do what I need to do, and I'm just incredibly grateful to them.
What is striking here is the sense of calm. In the face of adversity, doctors and nurses simply get on with the job.
The staff here are dealing with the biggest challenge ever faced by the NHS. They can save many of the patients, but sadly not all of them. And still, more patients keep coming every day.
And no one is sure how long this will last. For now, they can cope, but that depends on all of us playing our part.
What is your message to people watching or listening to this?
If people don't stay at home and they sneak out, this is going to continue to happen, and our staff are going to be exposed for longer. We're not going to have the equipment to do the best that we can by everybody who needs it. We do need to flatten that curve, and it is so serious. And I just wish people would really listen to what the government and we are saying.
In another part of intensive care, we met Ertan, who wanted to speak to us. 70 years old, he's a bus driver. He fell ill over a week ago and ended up in A&E.
Oh. What has it been like?
Well, with me, it was a terrible time because of my breathing. Symptoms started with the temperature, shortage of breath, and tiredness.
Instead of a ventilator, Ertan's oxygen is being regulated by this tiny device. If trials go well, they'll be mass-produced for the NHS in the coming weeks.
Well, hopefully you'll be able to see your wife again soon.
I'm hoping so because she's waiting. And I've got daughters, grandchildren, they're all waiting for me to go home. And hopefully I will. I will fight it. Definitely.
Okay.
And so will the medical staff here. It is harrowing to see the devastation caused by coronavirus, and humbling to witness the resilience of nurses and doctors, the heroes of this crisis.
And Fergus is with me now. Fergus, that was, to put it mildly, a sobering insight into the reality of what's going on. Now, in giving you this access, what were the staff there wanting to convey to you and to our viewers?
Well, the staff, the doctors, nurses, all the staff at UCLH Trust wanted to get the message across, stay at home, because it really will make a difference. And if anybody has any doubt about what coronavirus can do, I hope those images from that report will dispel them. But it is absolutely vital, they say, that people take social distancing seriously. Now, the level of care I witnessed there was absolutely superb. The extraordinary toll, though, it's taking on the staff. They have to wear that PPE, that protective equipment. Now, we wore the PPE the hospital provided for us, but we donated PPE to them so that we were not using their resources. What will stay with me, and this did have a profound impact on me, is the resilience and the professionalism of the staff there. But also, my heart goes out to the patients and the relatives. This is taking a terrible toll on them, and it's why we all must do what we can to prevent coronavirus from spreading.
Fergus, thanks very much. And as I understand it, you'll have more from the same trust for us tomorrow on a slightly different aspect of the story.
Yes.
Thank you very much. Fergus there for us, our medical correspondent.